Hi, I'm Rebecca McLoughlin. I'm a physiotherapist working in the red cell pain management team at St George's Hospital. This is a short video designed to give you some ideas about some movements that you might be able to do at home to complement any work you're doing with me individually or in our exercise group. This particular video focuses on some ideas for stretching, kind of lengthening movements that you could do. In this video, I use a wall to make it a little bit easier to think about stretching different parts of the body. So at home, make sure you've got a safe, clear area that you can do these movements in. If you haven't been working with us, then remember that if you're embarking on an exercise routine for the first time, it is helpful to get the advice of your GP before you do that. Remember through these videos that you know your body best, so you can adapt these movements, come and ask questions about them, make them bigger or smaller depending on what works best for you. They're all ideas. So we're going to start off today thinking about some stretching kind of movements for the legs. So turning to face the wall, first of all we're going to put one foot in front of the other, use the wall for a bit of support, and then think about bending your front leg. It's likely that when you do that, you might get some sensations down the back of the back leg. Just move to the point that it feels helpful for you to move to today. When you find that point, just holding the movement there and taking a couple of relaxed breaths. And then we'll think about a similar movement on the other side. So just swapping legs and repeating that movement. You might notice that you get sensations in different parts of the leg, or that your movement is easier or harder on this side. Just do what you can today. Next, we're going to think about a lengthening movement for the front of the leg and the hip. This one can feel a little bit awkward, but play around with it. So you can start off just thinking about bending the heel towards the bottom. Then if possible, you might be able to reach for your trouser leg and just use the resistance of your clothing to give you a little bit more of a stretch. Just find the point that you're comfortable to move to. And then when you're ready, bringing that leg back down. And trying a similar movement on the other side. If you can reach for your foot or ankle, you can do that. Or if all of these options are a bit tricky at the moment, there are lots of ways to move this part of the body. So just come and ask me for some more ideas. Next, we're going to do another movement that often increases sensations down the back of the leg, but this time turning with the wall behind us. Just going to lean into the wall, bend one leg and straighten the other, and if you're able to, lift the toes of the lengthened leg. This is likely to increase sensations down the back of the leg. So just find the point that you're comfortable to hold this. And then when you're ready, just easing out of that movement. It's quite an effortful movement, particularly for the bent leg. So just build up to it. This might be a good place to start. And then you make the movement a bit harder as you raise the toes and lean further forward. And when you're ready, just moving back out of that. Next, we're going to think about lengthening through the back and the arms a little. So we're going to turn to face the wall again, place both hands onto the wall, and then step our feet away and just let our head move down. So we're lengthening and opening up through the back and through the arms. Just find the point that you're comfortable to hold this breath and take some nice comfortable breaths. And then when you're ready, just ease out of that movement by walking the feet back towards the wall. We'll leave the right hand on the wall now. We're just going to turn the body away So we're kind of rotating our body away from our hand, and it's likely that you'll feel some opening, lengthening sensations through the arm, the shoulder, maybe into the chest. Just turn as far as it feels comfortable and helpful for you today. Taking a breath there. And then when you're ready, you can turn all the way around, swapping hands and doing a similar movement on the other side. Remembering that for every individual, the amount of movement might vary quite a lot between one arm and the other. So just do what you can. Then we're going to turn back to face the wall again. Put both hands back on the wall, and this time just walk the hands up the wall and find the point that you can reach the arms up the wall. For many people, they might find that one arm reaches slightly further than the other. That's absolutely fine. Just move to the point that it feels helpful for you. If there's a big difference between your amount of movement on one arm and the other, you could do this movement with one hand and then swap and do the other hand. When you're ready, the last movement we're going to do is a little bit more active in terms of moving through the stretch, but we're just going to think about both hands on the wall, and we're going to come towards a press-up movement. So just moving the body, nice controlled way, towards the wall, and then pushing away. Really thinking about using strength in your arms to push away, and nice control through the rest of your body. You might start doing 2 or 3 of these movements and then gradually build up from there. And then very last movement for today, we're just going to walk one hand up the wall and think about arching the body away. It's a nice way to lengthen through the side of the body, which sometimes we don't do very often. And when you're ready, coming back to standing, you can turn around and do a similar movement on the other side. Remembering to keep breathing. And when you're ready, standing up. Hope you enjoy those movements and you get time to practice them this week.